Hi, my name is Mason.
When I first met Mason, Jameson, and Jess, there was a lot of issues with arguments in the house. Mason would become very upset and physical towards Jameson and Mom and unable to communicate those needs. With Jess being the primary caregiver, a lot of that was on her because Dad works full-time.
Before coming to Thrive, our family was facing challenges like having a tough time going out in public, having a tough time in school, having a tough time doing any sort of activities such as sports or social outings, specifically with Mason and sometimes with Jameson and Mason getting along. The behaviors were very difficult to handle.
When I was in kindergarten, I felt nervous entering it and honestly kind of felt embarrassed.
Mason's needs were very much built with his treatment plan being person-centered. We really looked at what he enjoyed doing, so a lot of that was looking at building and constructing either Legos or out of art supplies, and we really fixated on trying to use those supplies to talk about emotional regulation and developing a way for him to have those coping skills. Since it was at such a young age, Mason was only about 6 at the time, we had to really break it down for him to understand his coping skills should be used so he can avoid arguing with his brother, hitting his mom. Mason had been in individual treatment, our adventure group in the summer, social skills group, our Lego group, our video game group, along with his brother being a part of our sports group. As for Mom, taking an approach in helping with school. At the time, Mason was in a behavioral school and had a difficult time navigating how to advocate for her son. So I would sit down with Mom before her IEP meetings and look at ways to advocate for her son, which led to him going back into the Warwick Public Schools.
The teachers saw confidence in me and Mason too, because they saw that we were trying to do the best we could for him.
I joined this gaming group at Thrive and we would play games and develop skills like staying calm, being trustworthy with other people, self-confidence, and just having fun in a safe way. I'm no longer aggressive. I don't swear as much.
We can go to the store together. We can go to the library. He can sit and read a book and I don't have to worry about him starting a fight with someone. He knows how to have a conversation more about things that everybody is interested in versus his own interests only.
Before I went to Thrive, it was tough. People were being mean to me. Some people just wouldn't let me play with them, which I didn't know what to do. And when I did something bad on accident, I didn't really know what to say.
I could notice that he was starting to become very stressed. He seemed to be upset with Mason a lot and even me, and that wasn't his normal because usually he's a very happy-go-lucky kid. So I decided to reach out and say, you know what, I think Jameson needs someone to talk to.
At Thrive, Miss Alex taught me to count to 10, I think, and hold my breath and then blow it out. And she also told me if you get scared or something, take a breath.
Jameson being able to communicate his needs to Mason when he wants Mason to play with him or he wants Mason to be a little bit kinder to him, which is tough sometimes with big brother and little brother. Mason is communicating a lot better with Jameson and explaining his frustrations and why he maybe sometimes is mean to Jameson as a big brother.
Hi, I'm Dawn Allen. I'm the president and CEO here at Thrive Behavioral Health. Thrive Behavioral Health deals with some of the most vulnerable populations. Through our connections in the community, we are able to reach out to people and put in place for them services that they need.
The community we work with sometimes is low income, single parents, adoptive parents, and the funding we receive allows us to really support our clients, engage with our clients, and let them benefit from treatment that they may not have had access to if we did not have the funding we had. We're also able to sit down and take a client out to make sure they have a meal, or I've had situations where clients didn't have meals and we were able to work and offer them some food cards to go to a grocery store and have that option.
We work very closely with police departments, with hospitals, with schools, with community agencies to make sure that we have the services here at Thrive to help all of our clients that are coming through our doors. I am very grateful to be working here at Thrive Behavioral Health with people who are so dedicated to what they do. They really have the knowledge to offer high quality services and to perform these evidence-based practice that have been proven effective.